Dr. Sanu Nair is an emergency medicine and urgent care physician at Cook Children's. In addition to her MD, she has a master's in public health. Because of her role as a physician and a parent, Dr. Nair is familiar with what it means to be a calming presence to patients, parents, and caregivers when they have questions that impact their family's health. Dr. Nair has taken time to reflect on what it means for us to live our lives after receiving our vaccine. Thank you, Dr. Nair, for your attention to detail, your willingness to help us explore the challenging landscape of advice and the lingering questions that inevitably emerge with the COVID-19 vaccine.
Hi, I'm Dr. Nair. Thank you, Dawn, for that intro. So now that more of the US adult population is getting vaccinated, it's time for us to talk about what that means for us. So to begin, when do we consider ourselves vaccinated or immune? Pretty much 2 weeks after any vaccine, that final shot of any vaccine, you are considered to be vaccinated. So for Pfizer and Moderna, which has 2 shots each, that would be 2 weeks after that second shot. And for Johnson & Johnson, which is a single shot vaccine, it's 2 weeks after that first and only shot. So great. Now we're 2 weeks out. And what now? What does that mean for us? So CDC just changed our guidelines, and now we can gather outdoors and without any masking or distancing, as well as gather indoors without any masking or distancing. Now we can actually go out and visit those relatives we have not visited in about a year. We can hang out and meet with our friends and neighbors, go to dinner. We can do some team activities outside, face-to-face, and so much more. So this is definitely opening up our opportunities. Now, there are many stores that have, following the CDC guidelines, adopted and said no more masking, but there's still a lot of businesses that have not changed those rules. So if you are visiting an indoor space that has those rules in place, please continue to wear a mask and socially distance. There are a couple of exceptions. We should still wear a mask and socially distance if you are still immunocompromised or if you are taking public transportation. At this time, we are still learning how well the vaccine protects those with weaker immune systems. So whether that is because a medical condition or whether it's because of a medication. If you are immunocompromised, you should discuss mask wearing and social distancing or any other precautions with your physician. The second thing on here is about public transportation. Now, this is a space where lots of people from all walks of life come and go from one spot. CDC currently recommends that we wear a mask and socially distance when we are on any type of public transportation. So buses, planes, trains, taxis, Uber, as well as hubs like airports, train stations, bus stations, and such. Now, for testing and quarantine, for the last year, we've had to do testing and quarantine anytime we traveled. Now, for domestic travel, we are free to travel anywhere within the United States without having to worry about this. This is good news for someone like me who had to add 2 weeks to the time I was taking off work to travel, which has now gone away. And a lot of times that meant I wasn't traveling. So this is good news. Now for international travel, it is a little different. Whether or not you test or quarantine when you go abroad depends on that destination. But when you return from a destination to the United States, you must have a negative COVID test or show documentation of recovery from COVID 3 days prior to boarding that flight. Now, luckily, a lot of resorts and common places will provide the COVID test as a courtesy. but you definitely want to call ahead and ask while you're planning that travel. CDC also recommends that we get tested 3 to 5 days after you return from your international flight. This is because there's always a chance that you might have encountered a new variant that might be vaccine resistant while you were abroad, especially since we don't know what the immunization rates are in other places, and we also don't know what public health measures are in place in other countries. Now, self-quarantine also here goes away. We do not have to quarantine after travel. CDC says that if you are around someone with COVID, you no longer have to quarantine. The only exceptions to this would be if you work at a detention facility or if you're at a homeless shelter. If not for that, this pretty much means that quarantine goes away completely. If you are a healthy person and you're not working at a detention facility or at a homeless shelter, then you don't have to quarantine for COVID exposure. You don't have to quarantine for domestic travel, international travel, or anything. So do we self-isolate ever? Yes. We would still have to self-isolate if we develop any kinds of symptoms of COVID. This would include cough, congestion, runny nose, sore throat, fever, fatigue, diarrhea, loss of sense of taste and smell. All these are symptoms of COVID. If you have any of those, you're going to self-isolate and get tested, regardless of whether you're vaccinated or not, and regardless of whether you've been exposed or not. This is the best way to keep yourself and our community safe. Now, vaccines are now available for kids ages 12 and up. Vaccines are actually 100% effective in ages 12 through 15. Many people ask, now that CDC has changed guidelines to get rid of the masking and social distancing, are unvaccinated children or those who cannot be vaccinated at risk? Here are my thoughts on that. As the pandemic has gone on over the last year, we have learned that the younger the children, the lower their risk of significant disease or hospitalization from COVID. So when I think about it, the age group from about 12 months to about maybe 10, 11, 12 years have always been at a lower risk compared to the older kids and teens. As such, so if we were to vaccinate all kids who are eligible, 12 years and up, now we can all be at the same lower risk. And in turn, we would actually be protecting the infants under 12 months. Those infants may be at a little bit higher risk compared to older children, but if we're all vaccinated, then they're less likely to come into contact with someone who has COVID. And even if they do, they're less likely to contract the virus from that person if that person is vaccinated. So they get to be safe as well. And once everybody is vaccinated, we can get back to our schools in a safer manner. We can start to have our kids participate in indoor sports and activities, and as well as social events after school. All in all, I think this is the light at the end of this long tunnel. For the most part, the bottom line for us is vaccinated, we can pretty much get back to a pre-pandemic life, aside from a few exceptions that I mentioned in the video. I wanted to say that this is CDC guidelines as they stand right now in May 2021. As you guys can understand, this is a moving target. As we learn more about the virus, its variants, and vaccine effectiveness in the general population. And as an acute care physician, I wanted to add the following insight as well. This past winter, we barely saw flu, RSV, and other illnesses that that typically circulate in the community. And we saw little hospitalizations as well. This goes to show us that how much masking and social distancing goes to curb the spread of disease. Definitely masking and social distancing is not something to do for the rest of our lives. But for the time while we are battling this pandemic, wearing a mask is an added layer of protection. So for anyone who feels unsafe or who is immunocompromised, he or she should always be able to wear that mask and can. So wear a mask whenever you want to. There's nothing wrong with it. With vaccines, we just have better choices. So just stay safe out there and we can get back to our lives.